Testing at a research lab at the University of Alabama at Birmingham shows a concerning increase in the super-contagious Delta variant of COVID-19 in Alabama. 34 of the last 48 samples tested at UAB's fungal reference lab, about 70.8% have been confirmed as Delta cases, Derek Moats, the manager of the fungal reference lab, said in a press conference Tuesday. He said the viral loads produced by these Delta cases are higher than any they've seen in the lab, which has been sequencing cases since late last year. A higher viral load means a more contagious virus. Unfortunately, these high viral loads, combined with low vaccination rates, are creating a potentially very dangerous situation for our state, he said. The only way to stop it from progressing is to get vaccinated. If you've been on the fence about getting vaccinated, now is the time to do it. Coronavirus cases in general are up in Alabama. The Alabama Department of Public Health reported the 7-day average for new cases reached 560 cases per day on July 12, the highest it's been since a huge number of backlogged cases caused a spike in mid-May. Can't see the chart? Click here. But Moats said his lab specifically looks for Delta cases. Each person who is infected with the Delta variant, they have high viral loads, which means they can easily infect people close to them in less than a minute, Moats said. Previous virus strains took as long as 10 to 15 minutes to spread with close contact, he said. With the Delta variant, it's different. It is much faster. He said that in the months following Alabama's vaccine rollout, when virus cases dropped, the lab had difficulty finding enough samples to sequence. A sample has to have a high enough viral load to be sequenced successfully, he said. For a while, few did. The lab was running tests on one group of 16 samples about once every week and a half. Now, that's sped up tremendously. The lab successfully sequenced 4 such groups in just 10 days between June 29 and July 8, around 71% of which were Delta, Moats said. Another group was tested late Monday. And the increased tests are a direct result of the increased viral loads caused by Delta. The state is still nowhere near the number of cases seen last winter, at the height of the pandemic here. But testing in Alabama has fallen, decreasing from more than 100,000 tests performed per week in January down to less than 25,000 per week as of early July. Moats reiterated a concern raised by UAB's Dr. Paul Gerpfert last week that Alabama could be the perfect breeding ground for the next coronavirus variant, one that might be completely vaccine-resistant. With our low vaccination rate and this rapid increase in Delta cases, I fear that there could be a new variant that is actually formed here in Alabama, he said. He said Alabama is now seeing community spread of the Delta variant.